Hey guys, so I'm really excited because our team did a podcast on 3 drugs that were done by Wang et al. Over in Wuhan, China back in 2020. Oh, that's this year. And basically what took place is that they were studying favipiravir, they were studying remdesivir, and they were studying chloroquine in vitro in cell lines that took place. And what they were doing is they studied in vitro. If you take a look, here's the x-axis right here, and here's the y-axis right here. On the y-axis, there was inhibition. On this axis right here, on the other axis, there was cell toxicity. So, we're going to take the first drug, which was hydrochloroquine. Hydrochloroquine had a line like this, which showed inhibition. So this is sort of this red line which showed inhibition, and toxicity was down here. Remdesivir showed a parabolic curve of inhibition. This is really awesome because now at University of Chicago, we're finding that in their study, their patients are basically getting discharged because fever has gone down, and in addition to that, this drug is showing to get people off of the ventilator very early. This was used in Ebola patients, which is awesome. Favipiravir is also one that was studied, and that we talked about in a different video. I want you to listen to the actual science of this done by the KneeTie team. Let's go to that, and then we'll talk about exactly what's going on at the University of Chicago.
How are scientists picking medications to use in clinical trials against COVID-19? The scientists are conducting the test on the basis of previous results produced by the drugs in tests conducted against similar viruses. In Wuhan, during the first outbreak, Dr. Wang and his associates did a trial of 7 different medications on coronavirus treatment. 7 different samples of COVID-19 virus were tested against drugs on February 2020. Ribavirin, peniciclovir, favipiravir, nafamostat, nitazoxanide, remdesivir, and chloroquine. Out of above-mentioned medication trials, 3 of them have shown significant results in vitro testing. Remdesivir and chloroquine showed the most promising result against infected cells.
So basically at the University of Chicago, what we know is that we have a randomized clinical trial showing that those patients who have severe disease, fever, and respiratory distress are having shorter lengths of stay from what we know now. We don't have the whole trial done yet. So, what is this drug used for? Remdesivir. Remdesivir is used for Ebola. And basically we know that this was helpful for Ebola patients. Now in another video we talked about favipiravir, and 4 out of 5 mice, we talked about that one mouse that died but the 4 that survived. But the 4 mice saved because of the actual favipiravir. Basically they were injected with Ebola, and there was inhibition of Ebola in that. The US FDA has not approved favipiravir. However, remdesivir may be approved very quickly for coronavirus, and it'll be very interesting to see because now the stock prices, as you see, of remdesivir have shot up over the last hours. So, have you heard of favipiravir? Favipiravir. How about favipiravir?